So having a diverse microbiome is core and a core concept for a healthy gut and a healthy brain. And this balanced microbiome helps to regulate systemic inflammation and can have a profound impact on neuroinflammatory illnesses like Parkinson's, Alzheimer's, ALS, etc., and on brain health and mood. And a healthy gut lining. So at the core here, like I said, 20 years ago when I had the Crohn's disease myself, I realized how impactful a leaky gut is on the systemic inflammation response in the body and the brain. So having a healthy gut, decreasing intestinal permeability, and everything that goes along with that, which we will dive into today, alters our brain function, alters our sleep, alters our mood. So if we have a leaky gut, we are prone to mood disorders and brain inflammatory disorders.
Now, we've heard from almost every single one of our speakers over these last 3 days about the importance of the gut-brain connection, and we know it's complicated but fundamental and has a huge impact on our immune system, inflammation, mental and physical health. And so it really is at the cornerstone of so much of what we've spoken about over these last 3 days. So I'm absolutely thrilled to welcome Dr. Jill Carnahan, who is an expert in so many aspects of health, general health, but also mental health. But one of her key specialities is the gut-brain connection. So we're incredibly lucky and grateful to have her with us. Dr. Carnahan is dual board certified in family medicine and in integrative and holistic medicine. She's the founder and medical director of Flatiron Functional Medicine. As a survivor of breast cancer, Crohn's disease, and toxic mold illness, she brings a unique perspective to treating illness and specializes in searching for the underlying root causes of illness through cutting-edge lab testing and personalized medicine protocols. She released in 2023 her new best-selling book called Unexpected: Finding Resilience Through Functional Medicine, Science, and Faith. And it's a powerful prescriptive memoir that will have you laughing and crying with her on the journey, leaving you with the key resources you need to achieve optimal health and wellness. She's also an executive producer, film writer, and featured in a new documentary about her journey of overcoming illness called Doctor/Patient. She has a large following on social media and is a frequent speaker at various international conferences and on major media platforms. So welcome, Dr. Jill Carnahan. I'm totally thrilled to have you here speaking about this super important topic. Thank you.
Thank you, Kiki. I am delighted everyone to join you this morning and talk about my favorite topic, the gut-brain connection. So let's dive in. All right, so gut-brain connection, as Kiki so well laid it out, this is at the cornerstone of so many of the lectures and topics we've talked about. And what's interesting to me is 20 years ago when I had my battle with breast cancer and then Crohn's disease and really started to understand gut health at the root cause because I was experiencing my own issues with inflammatory bowel disease, I really saw what was happening and we started to understand that. But what's happened since in the 20 years since is there's an exponential amount of research that is now backing up what we've always known to be true about lipopolysaccharides, about leaky gut, and about all the things we're going to dive in today that have everything to do with our mood and our sleep and our brain. So just the background here, the gut-brain connection, as we mentioned, it refers to this microbiome, this milieu in our gut, and all of the things, the metabolites, the neurotransmitters, the bidirectional communication that has to do with our brain and our overall mental wellness. So we're going to dive into there today, and I'm going to hopefully pull together all the pieces of how these two parts of our bodies interact and are one and the same in many ways. So these are a few key concepts that I want to introduce before I dive into all the details. First of all, one concept is bidirectional communication. So we have this communication from the brain to the gut and from the gut to the brain and back and forth through neurotransmitters, through cytokines, through inflammatory molecules, and even healing molecules. We have neuroinflammatory regulation. So at the root, a lot of times the gut markers that we see TNF alpha, IL-6, TNF alpha, IL-6, and IFN beta, all of these are very correlated with the inflammation in the brain. And when we see the cytokine inflammatory response and how it affects the brain, we realize that this is totally connected. Many of us got a primer, not necessarily those of us in medicine, but in the public, got a primer during the pandemic because we started talking about cytokines on the news and in public spaces and started to realize the importance of cytokines in our overall health. Short chain fatty acid and hormone production is another way that the gut interacts with the brain, and the impact on mood and mental health goes without saying. Okay, so just briefly, bidirectional communication. The vagus nerve acts as a major highway of communication between the gut and the brain. And we now know, in fact, one of my recent purchases, I love biohacking. I bought a vagal nerve stimulator that clicks onto the tragus of your nerve here. And I wear that in the morning just to stimulate my vagus nerve. And we know that the vagus nerve communicates to the brain, and the brain communicates to the vagus nerve through neurotransmitters through the gut. And this is one of those important pathways, maybe the most important pathway through the gut-brain communication. And then microbes themselves can cause immune responses, cytokines, as we talked about, and interact with the brain on a direct level. This is just an example of a diagram that shows how the intestines can produce short-chain fatty acids, serotonin through the intestinal wall into the bloodstream, and cytokines, and then these things through neurometabolic production, through endocrine response, and through immune activation actually communicate with the brain. And then the brain can go back down that bidirectional communication through the vagus nerve and alter our motility, alter our ability to digest and absorb foods. We all know when we have stress, maybe we lose our appetite, or we gain appetite, or we crave carbohydrates. These are all examples of how the vagus nerve communicates with the gut. And then on the other hand, we see that the host can affect the microbiota as well. So all of these different neurotransmitters, such as norepinephrine, epinephrine, dopamine, and hormones, can affect bacterial growth, biofilm, and biofilm disruption, decrease resistance to host, increase virulence, or decrease virulence. So then we have neuroinflammatory regulation, and we know that a balanced microbiome, and one of the first things I'm going to talk about in just a couple of moments, is the importance of microbial diversity. So having a diverse microbiome is core, and a core concept for a healthy gut and a healthy brain. And this balanced microbiome helps to regulate systemic inflammation and can have a profound impact on neuroinflammatory illnesses like Parkinson's, Alzheimer's, ALS, etc., and on brain health and mood. And a healthy gut lining. So at the core here, like I said, 20 years ago when I had the Crohn's disease myself, I realized how impactful a leaky gut is on the systemic inflammation response in the body and the brain. So having a healthy gut, decreasing intestinal permeability, and everything that goes along with that, which we will dive into today, alters our brain function, alters our sleep, alters our mood. So if we have a leaky gut, we are prone to mood disorders and brain inflammatory disorders. And then short-chain fatty acid and hormone production. Again, we're going to dive into this topic today. Short-chain fatty acids are the new superheroes, even in cardiovascular medicine, very key to preventing cardiovascular disease and inflammation. And I will show you all the data and the research on that. And then hormone production, estrogen, progesterone, DHEA, cortisol, and testosterone, even insulin, for metabolic resistance, can be mediated at the gut immune interface, the gut lining of those enterocytes. So this is another way in which we interact with our gut on a profound level. And then lastly, the mood and mental health, again, the topic of today's conference. The gut-brain axis is absolutely linked to mood disorders, and imbalances in the microbiome and leaky gut, excessive histamine production, etc., can absolutely alter our neurotransmitter production and our mood and our sleep. The microbiome influences our ability to respond to stress. So we already know that stress impacts the HPA axis, and through that and the vagal nerve, we can alter absorption. We can alter integrity of the gut lining, so we can increase permeability. We can alter production of things like dopamine and serotonin through excessive metabolites like Clostridia. So perfect example of this, if you ever do organic acid testing and you see one of the cresor, one of the markers for C. diff in the gut, and it's excessive, you might look over on the markers for organic acids and look at HVA, which is a metabolite of dopamine, and see that it's high. The correlation there is that if there's overgrowth of Clostridia, you'll often produce excessive kynurenate and quinolinic acid and excessive dopamine, which can be neurotoxic and neuroinflammatory. And so very frequently you will see the excessive Clostridia overgrowth in autism, in ADE, ADD, and mood disorders like bipolar schizophrenia because of that excessive dopamine component. And then chronic stress is associated with secretory IgA deficiency, which is our mucosal immune system. And if that's impaired, we often have abnormal overgrowth of bacteria, maybe parasitic infections or fungal overgrowth as well. So just again, reiterating that the roots of communication between the microbiota and the brain include the vagus nerve, gut hormone signaling, the immune system through cytokine production, tryptophan metabolism, which is a special case. This is where the kynurenate and the quinolinic acid, if they're elevated, can cause neuroinflammation and depression. It's basically a serotonin steal pathway where the body steals from the precursors like tryptophan and 5-HTP that are there to make serotonin, and instead shuns it along kynurenate and quinolinic acid, creating neuroinflammatory products instead of the happy, feel-good serotonin chemical. And the importance of early gut life in shaping later health outcomes is also emerging. And in the next few minutes, we'll dive into that diversity and how it starts at birth and can continue on either in a healthy way or a not so healthy way. So this is just a wonderful diagram, and all our references are below if you want to look deeper into the articles. On the left, you have a healthy HPA axis, neural circuits, immune system, and microbiota and their interactions. On the right, you have a depressed, and you can have increased cortisol, increased cortisol releasing hormone, abnormal disrupted neural circuits, inflammatory cytokine production, and an altered gut barrier, which is really the ground zero of a lot of these neuropsychiatric disorders related to the gut. Okay, so as I told you, I promise we're going to dive into diversity because at the core, there's a few concepts today that I want you to take away. One of them is diversity is king. Diversity of the gut microbiome really sets the tone of your gut microbiota, your cytokine production. And I always relate it to back in Ireland when there was a potato famine. So all the farmers were growing potatoes and they found a great seed that yielded, spuds that yielded great produce. And so they all planted the same strain. When that happened, then a blight came and disrupted the production and took out all of their crop, and they were left with no crop that year. But it was partially because there was no longer diversity in the crops they were growing. And I think that's very relevant to our microbiome because the more we have microbial diversity, the more we can withstand insults with stress and toxic overload and other things in our life, in our diet, in our lifestyle. So greater microbial diversity is associated with the body's ability to deal with stressors. Again, just like the Ireland potatoes, if you have more than one strain, you are able to more deal with the things that come our way. Individuals with disease are more likely to have alterations in gut microbiome, and multiple associations have been shown with reduced microbial diversity, including obesity, diabetes, cardiovascular disease, etc. Now, this begins at birth. When we're born out of our mother's womb in the birth canal, we actually are inoculated by the mother's microbiome and vaginal flora. And this is where we typically get the lactobacillus species and the bifidobacter that starts from birth. We know that there's a dramatic difference in C-section babies and their microbiome compared to those that are born via vaginal delivery. And even through their entirety of life, we can sometimes see the imprint different from babies born by C-section versus vaginal birth. Breastfed is also a big deal because through the mother's milk, we're inoculating the immune system and getting a more diverse microbiome. We can actually see the transfer through the mother's milk and the placenta. We all thought these things were sterile, and now the data shows that through the placenta, through the birth canal, and through the breast milk, we are all getting inoculated in our gut microbiome. So this just is a couple studies that show really how big a deal it is. This in particular showed that a reduced diversity of the gut's intestinal flora was associated with increased risk of allergic sensitization, allergic rhinitis, and eosinophilia. And back when I was in medical school, we were taught that things like eosinophilic esophagitis were very rare. Now we see them all the time. And part of that is because of less interaction with the environment. So we have less training of our immune system, and we have an epidemic usage of antibiotics, not only as children get sick, but even in the food supply in cattle and animal products. A lot of times the antibiotic residue is very high. So this study talked about those with low diversity on bacterial scores have higher levels of body fat and inflammation than those with high gut microbial richness. And this just talked about our diet, because one of the misnomers that I see as I'm teaching is we all think that a 10 or 20 or 30 strain, 100 billion colony probiotic will be good for diversity. And the truth is there's a possibility that maybe giving those 10 strain probiotics are actually creating more of a monoculture than diversity. So we know that diet is the role to increasing diversity, thinking about foods as the fodder for these diverse microorganisms, high fiber foods, fruits and vegetables, different FODMAPs like inulin, oligosaccharides, Jerusalem artichoke, asparagus, all of these foods that are very good for feeding the microbiome are critical for creating a microbial diversity. And what was nice is that changing diet, we saw permanent changes on the diversity of the gut microbiome. So the way or the route to increasing your microbial diversity is really getting a variety of plant-based fibers and foods in your diet, because these feed the microbes and they feed the short-chain fatty acid production, which are critical for anti-inflammatory effects as well. This study I just liked because it showed that a change from a low-fat, plant polysaccharide-rich diet to a high-fat, high-sugar Western diet in mice changed their microbiota in 1 day. So it doesn't have to take a long time. We often do those interventions that are like a 30-day elimination diet, and we see pretty dramatic changes. I remember when I first started medicine, sending someone out with an elimination diet with corn and soy and gluten and dairy and egg and sugar and alcohol all taken out. And they came back and they had lost weight and they had no pain and their migraines were better and they felt so much better. And that to me was always an aha in the beginning, because I realized, wow, we forget in conventional medicine that diet has such a profound effect on health, because we're taught that patients won't follow those diets. But the truth is, it's still at the core of a healthy microbiome and a healthy brain. Coffee consumption. So one of my favorite food groups, I'm having a little bit more this morning right now. Coffee is a rich fodder for the bifidobacter that create short-chain fatty acids. So we actually see good shifts in the microbiota with coffee consumption. For most Americans, it's one of the few polyflavonoids and flavonoids that they get in their diet. And it increases the production of short-chain fatty acids while lowering branched-chain amino acids. And then here I always joke, it's my two favorite food groups, coffee and cocoa. These are extensively metabolized by the gut bacteria. They produce anti-inflammatory compounds like butyric acid, which is a short-chain fatty acid. And this can create anti-inflammatory effects. So that is perhaps why we have all these beneficial studies for the heart and for the body with dark chocolate. So as I always say, go out there freely, enjoy a little bit of dark chocolate, but make sure it is gluten-free, dairy-free, fair trade, organic, non-GMO, et cetera, if at all possible, maybe 90% dark. And here, just the study that shows the good microbes such as bifidobacter and lactic acid bacteria feast on chocolate when you eat it. They grow and ferment, producing compounds that are anti-inflammatory, such as butyric acid. Okay, so just to remind you, ground zero, what's going on with the gut here. These are representing cells that line your gut, those enterocytes. And at the top there, you can see the gut lumen. At the bottom is the bloodstream. So these are only one cell layer thick. I think of them as tiles on our bathroom wall. And when we start to get intestinal permeability or leakage of contents from the gut lumen into the bloodstream, then we can have this dendritic cell start to sample and create a reaction. This is why in particular gluten, which opens up zonulin, I think of that as the trapdoor between the cells and then allows more permeability to happen. Even in someone who doesn't have celiac or doesn't have non-celiac gluten sensitivity, we all have an increase in intestinal permeability postprandial after we consume gluten. This is one of the reasons why almost all of my patients, because I'm dealing with complex chronic disease, autoimmunity, inflammation, long COVID, almost all of them are recommended to be gluten-free, because I don't want that trapdoor opening and creating more dumpage of products into the bloodstream, overwhelming the immune system. And again, not everybody has to be lifelong gluten-free, but in the cases that I see, I tend to find they do better. And I would postulate to say with mood disorders, with sleep disorders, with all the things we're talking about today, perhaps even more important, because for example, with celiac disease, about 50% of people react with gut issues, diarrhea, constipation, heartburn, malabsorption, damage to the intestinal lining. But about 50% of patients with celiac disease react with brain. So they'll react with insomnia, anxiety, manic symptoms, etc. So it's actually very interesting that many times gluten will have a neurological effect as well as a gut effect. Okay, so causes of increased intestinal permeability, these are listed here. And as you can see, things like inflammatory bowel disease, NSAIDs, SIBO or small intestinal bacterial overgrowth, celiac disease, protozoal infections, toxic exposures, especially mold. It's another one of my favorite topics. And what I see very frequently is mold exposure in the environment, even if a patient is unaware, will cause a massive increase in intestinal permeability. Patients will all of a sudden have depression or anxiety or sleep disorders, or they'll have increased histamine and food intolerances. And so this is a huge insult because it creates more activation of the mast cells, creates more histamine. And histamine, whether it's your brain or your gut or your mitochondria, will increase permeability. So this is a big deal. Food allergies, alcohol, strenuous exercise. So I'm in Boulder where we have lots of professional athletes and bicyclists and people like that. And I do have to be careful if I'm treating the gut and I'm having someone who is training for, say, a triathlon. It's usually not a good time to treat a patient with gut disorders when they're heavily training, because strenuous exercise will also increase intestinal permeability. So this is a diagram that just pulls everything together. It's been around a while. If you've ever heard me teach, you've probably seen this picture, but just all of these things on the left, like poor dietary choices, stress, emotions, infections, lectins in some people, systemic disease, low stomach acid, toxic exposure, especially mold, will create altered intestinal permeability. And this is where we get dumpage from the gut lumen into the bloodstream, like I showed you with the diagram earlier. And this is like the toxic load from within. It has a profound effect on cytokine and inflammation production, on creation of malnutrition states, on dysbiosis, on toxic overload, and on increase in food allergy, because all of a sudden the corn antigen or the wheat antigen is crossing over and the body's starting to react and create an immune response. In particular, you want to remember when we think about toxic load, which I talk about frequently, total toxic load also comes from within. And if you have a permeable gut and you have an excessively dense microbiome with excessive bacteria or fungi or parasites, you're going to have a toxic load just from those things that are coming through your gut barrier. And that will increase your risk of systemic disease, and especially in our case, mood disorders. Again, just another diagram that shows all of the things that contribute to this toxic load and create from a normal tight junctions in the gut to a leaky gut on the right there, things like stress, toxins, pathogens, food particles, drugs, and infections. All right, so we're going to shift from diversity and kind of understanding the leaky gut principle behind the gut-brain connection into metabolic endotoxemia. So now, why is this important? So we're going to dive into what this is, but this is at ground zero for the chronic complex diseases that we are all seeing. This is at ground zero for cardiovascular disease. It's at ground zero for obesity. It's at ground zero for diabetes, metabolic resistance, weight gain, etc. So this is really, really a core concept to understand. So what is it? It's when the innate immune system response becomes subclinical, persistent, low grade, this inflammation, because of the increase in circulating endotoxins. So these are gram-negative bacterial coatings that leak from the lumen into the bloodstream and create a low-grade chronic immune response that leads to fatty liver, leads to obesity, leads to diabetes or insulin-resistant states, which then can lead to cardiovascular disease, mood disorders, sleep disorders, autoimmunity, and I could go on, and I'll show you a list in a few moments. This increases inflammatory markers such as interleukin-6, interleukin-1, beta-interferon gamma, triglycerides, and postprandial insulin, creating this kind of pre-diabetic state. And it's characterized in the studies by an increase in lipopolysaccharide or endotoxins postprandial. So they measure in the studies 5 hours after we eat. And if those go 4 times the normal limits or the baseline, that is considered endotoxemia. Now, like I said before, we all have some degree of endotoxemia after we eat. This is why your patients who either fast and do 2 meals a day, or do intermittent fasting, or fast for 24 hours, or whatever they're doing, often they will tell you, as a clinician, they feel better when they're fasted. The reason for that is because they're decreasing their endotoxemia when they're not eating. So it is very interesting. One of the ways when we have a diabetic or someone who's trying to reverse that metabolic issue is we often will introduce intermittent fasting or fasting of some sort, because this will lower their endotoxic load. And like I said, increased risk of developing cardiovascular disease, diabetes, obesity, low testosterone in men and women, and especially for us, mood disorders such as anxiety and depression. So just again, I've gone over this a lot, but it's so critical to understand the microbiota controls and stimulates the innate immune system. The innate immune system through cytokines can be one of the main causes of depression, anxiety, and so many other disorders, autoimmunity, non-alcoholic fatty liver disease. Even with cardiovascular disease, I've reframed it a lot in my mind to think about cholesterol as an innocent bystander, and this innate inflammation, this glycocalyx damage to the endothelium all over our bodies, and oxidation of LDL. Those are really the culprits behind cardiovascular disease, not so much the innocent cholesterol. And it gets a bad name because, of course, it can become oxidized and sticky and cause cardiovascular disease. But if we go to root cause, this really starts in the gut. So what is an endotoxin? I alluded to this before, but it's a toxin produced within the body, meaning inside. So we have exotoxins like mercury, heavy metals, mold, and we have endotoxins, which come from the inside. It's a very potent immune stimulator, very inflammatory. I think it's probably one of the most inflammatory triggers to our human body. It's a component of gram-negative bacterial outer wall, and it circulates at low levels in healthy individuals. So we all have some degree of endotoxins. But when we get an insult to the gut, like mold, or when we get a poor diet with excessive trans fats and unhealthy fats, or when we have lots of stress and we increase intestinal permeability, or when we get mast cell activation after we've gotten COVID, these are all just examples of things that would increase the permeability and then cause an increase in endotoxins after we eat. How many of you or your patients will say, gosh, after I eat lunch or after I eat a meal, I get really tired, or I just don't feel well the hour or two after I eat? Anyone? If that's you, that's likely a component of endotoxemia, because this typically happens between 1 and 4 hours after a meal. And if you are experiencing an incredible amount of exhaustion, brain fog after you eat, I would suspect endotoxemia at the root. Now, I'll show you a few slides that talk about toxicity dependent on the type of fat in the diet, but this is an important thing. We'll come back to that. We talked about causes of increased intestinal permeability, and I showed you this before just to remind us. This is a little bit blown up, a slide of the same thing where you have the fragments, gluten, corn antigen, even maybe mold particulate or fungal overgrowth or parasites that can trigger an increase in intestinal permeability. And then right on the next side of the enterocytes, those cells like tiles on your bathroom wall that line the gut, you see the dendritic cells, the immune cells, and all of them are just sampling macrophages, what's coming through. And so then they get triggered, those T cells get activated, and you can have T and B cell disruption, activation, and autoimmune disease, dysfunction of T cells, all those kinds of immune activation that create mood disorders and inflammation. So I wanted to just talk briefly about lipopolysaccharide. This is the what it looks like, the structure of LPS. You have the lipid fatty acid layer on the bottom, and you have the core polysaccharide on the top. Now, the lipid bilayer on the bottom is made up of what's in our diet. So if we have a ton of French fries and burgers and trans fats, those are going to be sticky and saturated. But if we have lots of things like, say we have olive oil or fish or fish oil, those are going to be a lot more fluid and healthy. And the interesting thing about this is, it enters through the enterocyte, through the gut, and it does matter. Saturated fats carry this LPS at a greater rate than do fish oil or olive oil. And that has opposite effect on toll-like receptors. So think of these lipopolysaccharides as like boats that cross over from the gut lumen into the bloodstream, and they are carried with fatty acids that we eat by that lipid bilayer. And if that lipid bilayer is more saturated, it actually gets carried more quickly and more potently. And you're all going, does that mean like coconut oil and lard and butter? Yes, it does. Now, this has to be individualized for the patient. So you don't want to, let's go to this next slide here because it'll show, I think, very clearly what I'm talking about. This was a study that showed types of dietary fats in endotoxemia. So you can see the saline was the control there. The coconut oil, the one saturated fat they did in this study, was above average for translocation of endotoxins. Cod, fish, vegetable were below average, and then olive oil was neutral. So what does this mean? Well, what this means is if you have someone with cardiovascular disease, suspected endotoxemia, diabetes that's uncontrolled, you do not want to put them on a high saturated fat diet without controlling the endotoxemia, because you're going to make that LPS translocation worse with saturated fats. Now, do I use ketogenic diets? Do I use coconut oil, MCT oil, and saturated fats in my brain health and my Alzheimer's disease in my patients? Yes, 100%. Absolutely. So this is not a black and white answer. Many of you would like to be like all or nothing. It's not like that. It just is an important key to know what types of patients are going to do better on a lower saturated fat diet until you control their endotoxemia. So the bottom line here, the takeaway is if they have endotoxemia, you do not want to switch them from maybe a vegan diet to a keto diet without talking to them about the types of fats. Now, could they do fish oil? Could they do olive oil? Yes. And could they do some coconut or MCT? Probably. So again, it's really important to just understand the kind of patients you're dealing with before you just switch them, because the diet has everything to do with microbial diversity and with mood. And this just showed after a high-fat meal, the endotoxin increased a lot more in a type 1 diabetic. That's that green line. And you can see the increase in triglycerides postprandially as well. And they go up in all the patients, whether they were normal, obese, insulin resistant, or type 2 diabetic. And again, just another example of how we see the mucosal barrier on the left. On the left side, that's a healthy gut with that blue kind of mucosal barrier, low inflammation, strong tight junctions, low levels of pathogens. On the right here, we see a disruption in that mucosal barrier. So there's certain keystone strains like Faecalibacterium prusnitski, Ruminococcus, Akkermansia that all help with that mucosal barrier. So if we are devoid of some of the diversity indicators in the gut, we're going to have a less robust mucosal barrier. We're going to have more permeability. We're going to have more lipopolysaccharide-induced endotoxemia. And therefore, we're going to have more brain dysfunction, brain inflammation, neurodegeneration, and mood disorders. And this is just a review of the biochemistry behind this activation. The circulating LPS gets bound by the carrier. It's carried across the barrier and stimulates the CD14 toll-like receptor, activates NF-kappa beta, and then NF-kappa beta leads to increased expression of these pro-inflammatory mediators like TNF-alpha, IL-1 beta, IL-6, etc. And then those innate immune cells go on to create damage, inflammation, and even things like depression and anxiety. If you just look in PubMed and look at IL-6 and depression, you're going to see hundreds and hundreds of studies linking these cytokines with our mood disorders. So let's talk clinical. What does this look like in our patients? We can see leptin resistance. We can see chronic constipation. We can see mood disorders, especially ghrelin-related appetite and mood disorders. We can see blood-brain barrier inflammation, IL-6 up, inhibition of dopamine receptors. We can see cognition decline from the inflammatory markers. We can see memory loss. LPS can directly get into the amygdala and hippocampus and disrupt memory function. We can see lack of appetite because of low serotonin or even anorexia nervosa. We can see anxiety because it disrupts the hypothalamic pituitary axis and increases expression of corticosteroid releasing hormone. Chronic pain, we can see sensory neurons and dorsal root stimulation of nociceptors. Parkinson's, intracranial LPS causes microglial activation and neuronal loss. And this would go for Alzheimer's as well. Hypogonadism, this is an interesting thing because most of us want healthy hormones and healthy libido and all those good things that go along with testosterone. LPS can disrupt testosterone production. I've seen this very frequently. This is one of those pearls when I have a young man, say 30, 35, that should have normal testosterone levels and has a level of, say, 200 or 250, incredibly low. Often there's gut disruption, inflammation, tick-borne infection, mold disorders, mold exposures. So I often go deeper because that's just a sign that at his age, he's having a disruption in testosterone production. And of course, autoimmunity, chronic activation of the innate immune system in various tissues leads to the bystander effect where the body will attack self and create autoantibodies. And this is a role of diet and mood disorders. So just to, again, there's so many studies I could have quoted here. I just want to continue to bring it home to the fact that diet and mood disorders do go together. All right, so now we're going to move on to the vagus nerve and the bidirectional communication and a few of the studies that involve vagal nerve function. Then we'll talk about short chain fatty acids after that. So bidirectional communication, again, we talked about this in the beginning. Rats who have a disconnection of the vagus nerve to the gut have less innate fear and longer retention of learned fear. So there's this disconnection when there's no vagal stimulation from the brain. They have less ability to intrinsically know what they should be afraid of and avoid it. And certain strains of bacteria, Lactobacillus rhamnosus, has been shown to influence the vagus nerve by producing GABA and serotonin. The study with this was rats that were caused to swim for excessive amounts of time, which is stressful to rats. And on the rats that had that probiotic Lactobacillus rhamnosus and an intact vagal nerve, they could swim and be less stressed, less cortisol a lot longer, and higher GABA levels. Whereas if the researchers cut the vagus nerve and even then still gave them that probiotic Lactobacillus rhamnosus, it had no effect on their decreased stress levels and their decrease in cortisol. So with an intact vagal nerve, that lactobacillus was helpful. Without the vagus nerve, it was useless. And here we talk about GABA production by available probiotic strains. And if you guys have seen these coming out now, I'm not going to talk about any specific products today, but there are a lot of psychobiotics out there. What that means is these are probiotics that are claiming to have a use in mood disorders. Now, do I think that's valid? Just like I'm showing you the research here? Yes. But in clinical practice at this point, I have not yet seen one probiotic change the mood dramatically, maybe adding 10 or 20% to your therapeutic intervention. But at this point, with the research that we have and the probiotics that we have out there right now, yes, do I think they're helpful? But do I think they're a game changer? Not yet. So stay tuned. On this particular Lactobacillus brevi, LBO1, was a candidate for delivery of GABA. Now, let me just tell you my true opinion on this. My true opinion is that a lot of companies are finding a single strain they can patent. They can look at the research, do the research, put out their own research, maybe even unbiased, and say this strain, this one strain that we own, has an effect on the brain. And I just want to caution you, use your judgment. There's some great probiotics out there, but I, at this point, have not seen just the probiotic by itself transform a major depressive disorder. Okay, so anti-inflammatory effect directly from the vagus nerve on the body. Research shows that the presence of certain beneficial bacteria like Bifidobacter and that Faecalibacterium prusnitzkii, which is one of the keystone strains related to diversity, may stimulate the vagus nerve to dampen inflammatory response. And as I told you just this morning when I got up, I had my vagal nerve stimulator here. I'm just playing around with biohacking devices because I know that the more vagal tone I have, which can also be done through breath work, and again, there's a lot more experts out there than I am on vagal nerve treatments and modalities, but this is one of the key things I think as we go in an increasingly stressed society with more mood disorders, whatever we can do to enhance our vagal tone is going to be profoundly beneficial. This study showed that Bifidobacter akkermansi, Faecalis prusnitzkii, I think that's also Faecalibacterium prusnitzkii, contribute significantly to the suppression of pro-inflammatory markers in elderly humans. And this was from fermentation of resistant starch and proteins, which also increased short-chain fatty acids. So this is where we're back to increased diversity, decrease inflammation, and increased short-chain fatty acid from the foods that we eat. This is just from that study kind of showing, I love the little icons on the left, the blue healthy guy and the red looks like a little older man with a cane or woman, and how this chronic low-grade inflammation, or inflammaging as we often call it, is related to the gut dysbiosis. So if we can maintain a good healthy gut membrane integrity, if we can decrease or reduce the translocation of lipopolysaccharide, if we can increase production of short-chain fatty acids, if we can increase vagal tone, these are all powerful ways to help our overall health and decrease aging as we reach our later years. And some of that is probiotics. I'm a huge fan, but some of that is the foods that we eat, the resistant starches from plant-based foods like pre and probiotics. And then another way the vagus nerve affects us is through neurotrophic growth factors. It's involved in promoting the growth and maintaining neurons in the various regions of the brain. So we actually have a neuroplastic effect of the vagus nerve as well. And this particular study shows that Lactobacillus rhamnosus GG affects BDNF systemically in the brain of these rats. So it's actually increasing production of BDNF, which can cause regeneration of nerves, increase neuroplasticity, repair after concussion or damage. Really, really powerful stuff. So microbiome and mood, just a couple studies here. There is much evidence for the links between the composition of the microbiome and the brain processes. Certain microbes, as we talked about, are linked to psychiatric disorders, anxiety, depression. I talked about the kynurenate quinolinic acid pathway, talked about excessive clostridia, talked about lack of good bacteria, lipopolysaccharide, lack of short-chain fatty acids. And these are all the different ways in which our gut affects our brain. Microbiome and mood. Increased ketogenic diet may prevent seizures associated with epilepsy by increasing the population of certain bacteria like Akkermansia. So that's interesting because that particular study talked about increasing ketogenic diet, and that may be one of the reasons many of us know that a ketogenic diet has been found to be useful in those with epileptic seizures. And this is one study that alludes to the cause, that it may be Akkermansia. Now, Akkermansia happens to be one of my favorite keystone strains, and I've been teaching this stuff for, 10 or 20 years. And I have often said, if anyone could develop a probiotic with Akkermansia, they would be very wealthy because it's such a keystone strain. And prior to recently, we haven't had that. Now we actually do. There are some companies that are making probiotic strains with Akkermansia, but it's one of those indicators. If you're looking at a stool test and you see no Akkermansia, that alone can indicate low diversity because it's such a keystone strain for the correlation with a microbial diverse gut. And then in mice, consumption of probiotics increased plasma levels of serotonin's precursor tryptophan, similar to an antidepressant, citalopram in that case. And this is that pathway I talked about. This is not a lecture about kynurenic acid, but if you don't know about this, it's one of the core concepts in depression and the gut. So if tryptophan is blocked from making serotonin and melatonin because the IDO enzyme is upregulated, you can see that arrow there, high cortisol, pro-inflammatory cytokines, gut infections, parasite infections can all inhibit tryptophan to make serotonin through the IDO enzyme. And instead, it steals this tryptophan, makes kynurenine, which is not super toxic, but when it goes down this KMO pathway to quinolinic acid, neurotoxic right here, this is a really big deal because it's NMDA receptor excitotoxic. And this is one of the biggest pathways you will see with depression related to gut and inflammation. And this here, we just have Clostridia and neurological perspectives. This is just my reminder to tell you about Clostridia and false neurotransmitters, excessive dopamine, which I already did, but Clostridia is a big player. Typically, you will see that either stool or you may see it in the organic acids. This talked about administering vancomycin, a heavy hitter for Clostridia, to improve diarrhea, but also behavioral symptoms because those kiddos were having excessive dopamine production and did well on Clostridia treatment. So other ways you can do that, according to some of the research I've done and in clinical practice, I find that doing a 5 to 7 day course of metronidazole, tinidazole, vancomycin, or the Nudificid is great, but then you do a better job doing an every 3 day pulse of those antibiotics for 30 days than you do if you do just a 7 day course. So that's my method of choice of treating someone with excessive Clostridia. Now, black cumin seed can also have a good effect, so I typically add that in as well. Okay, and then I just wanted to mention mood and microbiome here, and how, again, you could pull many studies linking autistic spectrum disorders and gut microbiota, especially in relation to fungal overgrowth, Clostridia overgrowth, and lack of diversity. Those are some of the common things that we see. And this was just a couple of studies on mice and exaggerated response to probiotics with mood disorders. And in particular, the probiotic strain Bifidobacterium longum 1714 played a healthy role in this stress response of healthy volunteers. And we see microbiome in attention deficit and hyperactivity disorder. So also related to excessive dopamine metabolism, inflammation, cytokine production, especially IL-6, and excessive cytokines of other types. And personality, I just thought this was fun because it's kind of interesting. People with larger social networks tend to have more diverse gut microbiome, suggesting social interactions may shape the microbial community of the gut. And we know that because we know like houses and hotels have a microbial imprint of the inhabitants. And as someone moves into a new home or as you go to a hotel, as you're there for 24 hours with your family or yourself, you actually change the microbial inhabitants of that room, which I think is fascinating. Increase in dogs. Unfortunately, cats do not increase microbial diversity according to the studies, but dogs do. Having a dog at home increases diversity. Also, adults who traveled more frequently ate more diverse foods with naturally occurring probiotics, were breastfed as infants. Those are all markers of increased diversity. Women's microbiome were shown to be less diverse than men in general, and negative relation to unemployment and dog ownership. All right, so this is effects of gut-derived endotoxin, some of those endotoxemic effects I talked about with LPS on anxiety-like and repetitive behaviors in mice. This just alludes to the fact that things like OCD can be gut related. I've seen that very frequently, where the anxiety-like behavior, the bucket of anxiety, typical behaviors with a component of OCD can be related to gut. And I have seen in clinical practice over and over and over when I do stool and organic acid, especially on children and young people, and I treat that, often their anxiety, their depression, their obsessive compulsive tendencies go away. And this again just shows that was some of the pathways. We've seen this a lot now, but just how the gut and brain interact, and especially along the wall, the lining of the gut, when there's permeability, when there's increased cytokines, when there's not enough short chain fatty acids, and all of the many things we've already discussed.